to this afternoon's public hearing. This hearing will include Columbus City Council's Health and Human Services Committee. Specifically, we will be discussing the state of youth homelessness in our community and services that are addressing the issue. I am Councilmember Priscilla Tyson, and I am Chair of the Health and Human Services Committee. Before we begin, please be aware that this hearing is being recorded or rebroadcast on CTV, the Columbus Government Television Channel 3. The rebroadcast schedule is available at www.columbus.gov. I would like to acknowledge the Community Shelter Board, Michelle Heritage, Executive Director, and Sarah Logan, the Community Relations Director. They have worked with their partners in coordinating this hearing. We are here today because the Community Shelter Board received a $6.1 million grant from HUD, which is intended to dramatically reduce homelessness among youth aged 24 and younger. This hearing will focus on the work being done to coordinate access, rapid rehousing, transitional housing, permanent supportive housing, and other services. Presentations will be given by the Huckleberry House, the YMCA of Central Ohio, the Homeless Family Foundation, Kaleidoscope, the Community Housing Network, and the Community Shelter Board. In addition, this hearing will cover new resources for youth, the needs assessment that identify the number of homeless youth in our community, as well as other important factors needed for youth to thrive, the vision around serving homeless youth, the planning process, which included a multitude of community partners, the goals of this initiative, and the projected impact of all these efforts. Before we begin, I want to acknowledge Kim Stans, who is the Human Services Coordinator for the Department of Development. Kim is available to answer any questions from the city. He's also been part of this effort to address youth homelessness since the initiative began. I will now start the presentations. Michelle Heritage, Executive Director of the Community Shelter Board, will give an overview. Michelle, please begin with whenever you're ready. Good afternoon.
Well, good afternoon. I am so pleased to be here today. I want to start by thanking you, Councilmember Tyson. You are always looking out for the most vulnerable in our community, and having this hearing and informing our community of the work that's being done with our vulnerable youth. I really can't express how much I appreciate it, and I also want to recognize Kim Stans, who's in the audience. Kim has been with us on this from the very beginning, and he's been really incredible in getting people to care about this issue, informing, and really just being at the table in both leadership positions and participating since the very beginning. And I think we started more than 2 years ago on this. And so, Kim, thank you for all that you've done. It means a lot, and we wouldn't be where we are right now without you. So thanks. Appreciate it. So I wanted to let you know, in July of 2018, the U.S. Department of Housing and Urban Development selected Columbus and Franklin County to receive a new youth homeless demonstration program funding to demonstrate how a comprehensive approach can dramatically reduce youth homelessness. A Place to Call Home for Youth is our collective plan to guide local efforts to develop and implement a comprehensive new approach, projects, and strategies to ensure that all youth aged 24 and under have a safe place to call home. According to the findings of the needs assessment conducted to inform the new plan, more than 3,000 youth are estimated to experience literal homelessness annually, and another 1,400 are at high risk for literal homelessness in Franklin County. And I just want to put an aside there, all of us, I think, agree that we believe those numbers are actually higher than that. So that's the best case scenario. The youth that participated in the needs assessment stated that their #1 reason for homelessness is broken relationships, and 36% had experiences with the foster care system. 46% identified having a mental health challenge, and it's been proven that youth with substance abuse and mental health challenges are 2 times more likely to return to homelessness. 39% have less than a high school degree, compared to 11% of the general population. And it's clear that we need developmentally and culturally appropriate services because 72% of the youth we surveyed were Black or African American. It's been proven that LGBTQ youth are 2.2 times more likely to experience homelessness. Learning all this, we set out to develop a comprehensive and coordinated new system that would lead us toward our vision that all youth in our community have a safe place to call home. I'd like now to introduce Aubrey from Community Shelter Board, and she's going to talk a little bit about the planning process. Aubrey Jones.
Good afternoon, Aubrey, but I also want to mention in the audience is Michael Corey, who is the Executive Director of Human Service Chambers in the room. I also see Steve Gladman. Thank you for being here. Appreciate your work around affordable housing in our community. Thank you so much. Aubrey, the floor is yours.
Thank you for having us, Councilperson Tyson. So through the planning process, we involved a ton of community stakeholders. The whole entire process was overseen by the Continuum of Care, or our COC. And then we had the Youth Core team, which was made up of leaders and subject matter experts working and advocating for youth experiencing homelessness. Those team members acted as work group leads and convened additional community stakeholders around child welfare, education, employment, health, justice, coordinated access, human trafficking, inclusion, housing, data, advocacy, communication, and education. I'd also like to highlight that our Youth Action Board played a critical role in the development of the plan. This was youth with lived experience who helped inform the entire process. They were included in the core team meetings as well as the work groups. So our goals. This is what I like to consider the meat of the plan, if you will. The work was aligned with both the United States Interagency Council on Homelessness recommendations for addressing youth homelessness, as well as CSB's community framework. Our first goal was to identify all youth experiencing homelessness or at risk of homelessness. We wanted to develop one universal screening tool where we'll be able to identify these youth at multiple access points. By identifying these vulnerable youth, where they already access services in the community, we basically have a no wrong door approach. Our second goal was to prevent homelessness for youth whenever possible. Our third goal was to provide immediate access to low barrier shelter and services for all homeless youth who want it. A critical objective in this goal was to ensure that shelters are welcoming, safe, and an inclusive environment for youth. Our fourth goal was to connect all youth who are homeless to housing and support services. By quickly assessing the youth's needs, education, employment, support systems, et cetera, we can connect them to the services that are individualized, high quality, and aligned with evidence-based practice. Lastly, goal number 5 speaks to the need to continually reassess, refine, collaborate as a community to get a functional end to youth homelessness. Thank you. So next we have Becky Westerfelt from Huckleberry House.
So, may I ask just a quick question, Aubrey, and Becky can come up. So the goals, the 5 goals that you have here,
Yeah.
these are the goals that everyone's working on collectively. And so to identify all youth experience homelessness and an imminent risk. So is that how the number of young people that you said?
That 1,400 is at imminent risk.
Okay.
Yep.
Thank you. Thank you.
Mm-hmm.
Hi. So I would also like to echo Michelle's thanks for letting us come and tell you about this amazing plan that I believe, as an advocate, will change the experience of young people in our community. And so I'm very excited about it. The slide that you see, Huck House will be providing the coordinated access and rapid resolution portion of the plan. And that team, as you can see from the slide, will be primarily focused on making sure that we bring in the young people that need these services and make sure they land where they should land. Not to sum it up too briefly, but our goal, and one of the things that we learned, was that young adults got lost, and they gave up when they got lost. And so part of the CAR team is to ensure that they don't get lost and therefore give up before they've had a chance to even access services that could help them. But in addition to the case coordination, the screening, the assessment, we really view this team as providing a role that we think will facilitate the entire system, the housing portions as well. One of the things that we know from having talked to so many of the youth and our own assessment is what I mentioned before, that oftentimes young people will give up because they faced a barrier and their problem solving didn't include a whole range of options, either because they didn't know or they didn't understand. So one of the things that we're excited about is doing problem solving before a young person gets derailed. And that will give them an opportunity to experience and really try the solutions that are available from the adult system. An example that happened last week is that we were talking with a young person who had called to get their place in line or their spot on the wait list for the adult shelter, but his job didn't allow him to make phone calls, and he felt that he couldn't make a phone call. And so when we talked to him, of course, we started talking about that's one option, which is to give up your place on the wait list, but there are other things that we can do. Talk to your employer, find alternatives, talk to the hotline. And so in doing that problem solving in real time, we help young people develop the skills they need, not just in the immediate problem, but also it's a life skill we all need. Another part of what we see as this team providing is to remove the other barriers that young people have when it comes to just being intimidated or not understanding why they're being asked what they're asked. Sometimes, young people are quick to take no for an answer, and they'll give up. And so part of what we will be providing is that adult who will say, wait a minute, let's not give up yet. Let's keep going. There are ways to solve these problems. And I often compare that to teaching someone to drive. Most of us drive, we take it for granted, the skills, but there was a point in our lives when we didn't have those skills. And we were taught those skills through a combination of adult guidance and practice. And so some of the skills that we're asking these young people to do to navigate these systems really just require practice and adult guidance. And the third role that we see for the CAR team is that they will be involved with all the different parts of the system. And from that point of view, we'll have a bird's eye view of how not only the different program components function and how well we've constructed them from the get-go, but we'll be able to see how they interact with each other. Because our goal is that a young person goes through the entire system in a way that doesn't feel like they're leaping from one lily pad to another, but they have a seamless path through to success.
Yeah, these are new mics, so. I'm
Oh,
just being,
that's well, they're very high-tech looking.
yes. How many people will be on your team?
Right now, we will have a staff of 3 specialists or line staff workers, case managers, a youth peer-to-peer position, and then the manager of the program, which is not just a manager for CAR, but a manager of other programs. The other thing is that we really are hoping to mobilize all the parts of Huck House to this because some youth who choose not to access or can't access the adult system, then we might be able to provide services to them through the other parts of our agency. An example would be a minor.
So I just want you to kind of, so this is the beginning of the process, correct?
Yes.
Okay, so just tell me, so that an individual who is a young person under the age of 24 is now homeless. And does this person come through the system through, I'm just trying to understand how it's going to work. The shelter board, is it coming through, how would these individuals get to you and your organization?
So one of the things that we wanted to do was to take advantage of the natural help-seeking patterns that youth already have here in Columbus. So there are 4 of us, and I would say the CAR team is the CAR team for this process. The other parts of Huckleberry House is one of 4 access points. So it's us, Star House, Kaleidoscope, and the Center for Healthy Families. Those are organizations that represent kind of the natural place that youth already go. And so we are working together to create a somewhat seamless access to either the adult hotline, or we are also going to create, and I'm going to call it the wrong thing, but a list of young people who either won't go to the adult shelter or on the wait list that we will provide services to while they're waiting, and hopefully we might resolve their housing problem before they even have to go to the shelter. So it's a work in progress. If you ask me this question in a year, that may have changed, but we tried to, in general, this plan, if you kind of read more of the details, we really tried to accentuate what is already working in Columbus and use those assets to create a system that isn't just whole cloth new or separate.
Okay. And I appreciate that you're working with the other organizations. And so, again, as I'm hearing from everyone, I think that I want to make sure we have this I personally want to have a very clear picture. So that's why I was asking, okay, how do they get to you? And if they come to you through 4 organizations and they get to you, and then you'll do additional screening and resolution, and then do any assessments that they may need, is that correct? And then provide them with any other interventions that are needed to either either not have them continue to be within the homeless system, they can go into if they can go to be back with their families, or any other, or find other places for them before they have to continue to go through the system.
Yes, and just to highlight 2 of the points that you made, this plan does have a strong element of family reunification. That's certainly something I think we as a community value, that if you work with the family, it could be that they could live at home. The second part is that we already have young adults who go through the adult system, and so part of our job as the CAR team is to not just kind of brush with one stroke whatever youth needs, but to figure out who's going to fall off track and who needs that extra help. But we do know that some young people are going to do okay with the adult providers without any intervention.
And those that don't, you're there to help.
Yes.
Okay, thank you. All right, thank you.
All right, thank you.
Hi, Sue.
Yes. I just want to echo all the thanks and the excitement we have as the YMCA of partnering with this great group that's behind me. It's just been so amazing and exciting to see what we can do for these youth that we are serving. So, the YMCA has been for a couple decades now addressing or reducing street homelessness in Columbus. And something that we have found through that process is that rapidly rehousing individuals has become an increasingly important tool to reduce homelessness. And currently, the YMCA serves in all 7 shelters, homeless shelters, using this rapid rehousing tool. We have case managers located at each site to rehouse the most vulnerable in our community. Right now, we are prioritizing Each of the vulnerability with chronically homeless individuals with a disabling condition, pregnant women, veterans, and transitional age youth. So those are the 4 populations we're currently rapidly rehousing in our shelters. In the last 10 months, we have been honored to serve over 1,400 individuals. We have found that rapid rehousing is an effective intervention for not only adults, but specifically transitional age youth. Getting them off the street or out of shelter very quickly for this population is important. The YMCA will utilize the same core components that we do in our other rapid rehousing programs, which is housing identification, time-limited rental assistance, case management and services. But with our young individuals, it's extremely important to tailor each component according to where they are in their life journeys. For example, housing identification. Some youth know exactly where they want to live, and the program will approach the landlord of the chosen location to describe the rapid rehousing services, and landlord supports it. But however, many youth have no idea how or where to find housing, and case managers will make sure to match them with an appropriate partner landlord in an area that they will identify fits their needs. Because of more intense case management is involved, the client-to-staff ratio will be much smaller than our normal rapid rehousing programs. The YMCA is currently ready to deploy 7 case managers to this important critical need in our community. These individuals are client-centered, utilizing progressive engagement techniques to ensure that once housing is identified, they are able to help stabilize and connect them to the community. Employing these strategies successfully requires keeping the experiences of the TAY in mind when engaging and doing so in a very comfortable manner. Our plan is to walk through this journey with our youth for up to a year. That's it.
All right, Sue. So your main role is to make sure that these young people are in safe housing as quickly as possible, and to provide them with the resources that they need and the tools that they need to be able to stay within the permanent housing, or at this point, to provide them with employment, education, whatever is needed
Yes,
for them
absolutely.
to be able to take care of themselves.
Yep, to
And
stabilize.
And to provide those supports for them to take care of themselves. Is that correct?
Yes, ma'am.
All right, and so you said you would provide that support for a year?
Up to a year,
Up
yes.
to a year, okay. And I guess this is a question, and maybe it's for, you could answer it, or Michelle can answer it. What is, because I know we're talking about homeless youth 24 and under, and so the individuals that you'd be working with, what's the average age of the individual that is needing these services?
Do you want, 18 to 24 is where we focus most of these. Is that, want to add anything?
So we anticipate the majority of the youth that we'll serve will be between 18 and 24, and some of the youth will be under 18, and that's where Huckleberry House will be mobilized. There's special considerations when you have a person under 18, obviously. Some of those young folks are emancipated and able to live on their own, and so the younger that we see an individual, obviously Huckleberry would be involved more often, and Children's Services has been with us on this path as well, so that, especially if we get very young individuals, you could find a 12, 13, 14-year-old person that needs these kinds of services, and so we'd be working in conjunction together. That's why this whole collaboration is important, that we're all together all the time communicating, because of even if a youth is 17 and technically underage, they may be at a very different point than a different 17-year-old that needs
Right.
different kind of intervention.
Okay, thank you. Thank you.
Thanks.
Thank you, Sue. Our next presenter is going to be, is it Donna Powell and from the Homeless Families Foundation. And then, are you and Aaron coming up together? Is that, or are you doing it separately? Okay, so Donna. You get the spotlight, Donna. Go ahead. So let me just be clear. So are you both presenting on the same topic?
We're talking about the work that our organization
Yeah.
Doing together?
We will be serving very different clients through this process. How's that sound?
That sounds fine. Okay, so Donna, you can go ahead and start, and then Aaron will come up after you. Is that
Okay,
good?
that's great.
Thank you.
The role I would want to say, and first of all, thank you very much for having us here today. But the role that the Homeless Families Foundation, or the part that I see that we play here, is that is our area of expertise, and that is working with families with children and expectant mothers. And so our focus with that 18 to 24-year-old group is going to be folks who have children or are expectant. And of course, their journey is going to be different than a single youth that's on their own that's 18 to 24. So when they would be referred to us through our partner agencies, and we would have case management and very similar intensive care around, workforce development and intensive care, mental health, whatever their specialized needs might be. And that would be, our expectation through this grant, but of course this whole year will develop that baseline. But the goal would be that the Homeless Families Foundation would serve about 44 families or expectant moms. I think it's going to be a lot more than that, but that's where we think what we will do. But this year will tell, I'm sure.
Thank you. I think, obviously, as we're listening from the, in council chambers and listening in from the audience who will see this on tape, beginning to see a pattern of serving different groups of people that are homeless.
Yes.
And so you're specifically focused on the individual that is, I guess, an expectant, so a mom and her children, or a mom who was getting ready to have a child.
Absolutely.
And so, again, I think that the requirements are different because you now have to make sure that during that period of time, who's caring for the children? Are they going to be in school? Are they be in the nursery, or getting daycare services, as well as the expectant mom? Is she getting to the, making sure that she's going to get to her physician's appointment, that she have the, the resources that she needs so she can have a healthy baby, and then thinking about that she would not be working for a period of time, and then thinking,
Yes.
and how to, once the baby is born and she is now healthy, how to get her back moving and taking care of her family. So these are different challenges than the individual that is a single person that is in the system, that is now homeless, that now needs to have a different level of care by whether it's the YMCA providing that aspect of the care, or the care that Becky is doing in terms of the coming through her system, but it could be just a young adult that's coming into the system, and then that takes different care to help them to move forward. So these are great partners looking at different
Yes.
groups of people that are certainly, that as they are homeless, providing the resources to move them out of being homeless to being able to take care of themselves in a home. So I
Yes.
appreciate you being a partner in this collaboration.
Well, thank you very much.
Thank you.
And,
I hope it's not more than 40. I mean, you're 44 people.
We seem to, with a lot of our most recent programs, especially around expectant moms, It's just, it's very high, and we seem to be hitting the ceiling with those numbers. So I just think it's going to be higher than that, but we'll see.
Well, I appreciate your work, and so much of that is around poverty.
Yes.
And that's poverty is the issue that is driving the majority of this. And so we know as a community that has to be a number one consideration of this community is poverty.
Yes.
So, but as we're moving through that, I'm excited that we do have this $6.1 million to be able to help the families that through this grant will be able to help them to move forward. So thank you.
Well, thank you for your time.
Thank you. All right, Aaron Upchurch, Kaleidoscope.
Good afternoon.
Good
Erin
afternoon.
Upchurch, Executive Director for Kaleidoscope Youth Center. Before I begin, if it's okay with you, I'd like to invite one of our recently housed youth to stand with me.
That would be great.
Waverly. So often we tell their stories without them, so I'd like her to just, oh no. Thank you. The mission of Kaleidoscope Youth Center is to serve and support LGBTQIA+ youth and young adults, ages 12 to 24. I think I'll just start with some statistics and some information to back up what's already been shared. We know the number one reason for our young people to be homeless is family rejection, whether they're being kicked out of the home or the turmoil is just so bad they can't stay there. It's not safe for them socially and emotionally. So that is the number one reason. Our youth are 120% more likely to be homeless than their peers. And 40% of all homeless youth are LGBTQIA+ identified. And so when we look at the numbers that Michelle shared, where there's about 3,000 here in Columbus, anecdotally, we know that just under 1,500 young people in this city identify as lesbian, gay, bisexual, transgender, queer, intersex, or asexual. That is the LGBTQIA acronym. We also know that these numbers increase almost 40% for youth who are transgender or non-binary. Last year in 2018, a little over half of the young people that we served just in our center were Black or otherwise members of communities of color. And so again, when we look at all of our statistics for our young people, and we know those numbers go up for trans non-binary youth, they go up even higher for trans non-binary youth of color, in particular Black youth. And so I think it's just a good framing to understand who we are serving. Something that's been really important for us is the need to engage in culturally responsive services and care. And so that can be things around, basic LGBTQ 101 around pronouns. What does that mean? How do we talk to our young people? How do we, talk about parents as parents, instead of gendering everything. And so a lot of our work has been around being culturally inclusive and responsive. Unfortunately, we don't have a lot of mechanisms to count the young people here in Columbus who are LGBTQIA because they're not in the places that traditionally homeless youth hang out. They are, but not collectively. And so, unfortunately, a lot of our young people don't meet the definition for being literally homeless or imminently at risk because they're couch surfing or they can stay with somebody, for a couple of nights and they have to go. And so that adds a different pocket of vulnerability for our young folks. The ways that we are participating with this project is around a host home network. We are modeling this after a program in Cincinnati as well as Minneapolis, Minnesota. But essentially, it's volunteers open up their homes for our young folks to stay with them on a short-term basis. So that could be emergency, or it could be up to 6 months. And through that, Kaleidoscope Youth Center has a program called Connections, which provides case management and support to link to other services while they're waiting to get into other housing opportunities here in the city. What's unique about it is we are able to center the needs and experiences of LGBTQIA+ youth. And so what that means, all of our staff are trained the way they need to be trained. They are able to be not just inclusive, but also affirming in our practices. And we know that is the number one barrier for young people to get any kind of services is the fear of not being affirmed or included. Thank you very much. I'm gonna see if there's anything else. Any questions?
First of all, I just really appreciate the work that you're doing with our young people, and that you're absolutely right. If I think about just the numbers of individuals that are within our shelters, they are majority Black, African-American people of color. That is an absolute fact. And that is because, well, and again.
It's a lot of reasons, a different hearing.
But let's just, but again, poverty, I mean, there's a lot of issues but poverty is
Absolutely.
key. If you begin to understand the amount of money individuals make, as we begin to look at things, like if you just look at the Women's Commission and to think about what a woman makes, and then you look at what a Black woman makes, you look at a Hispanic woman, what they make, I mean, it's poverty is the issue. And then when we look at, like, as you're saying, the LGBTQIA, what's the other part? Plus, I mean, because now it's LGBTQIA now, but plus, and you start to think about who those people are, what their race is. Again, that's a challenge that we're dealing with in this community, and we have to be willing to state that that is the issue. That is who we're talking about, that you are serving through this particular, not just you, but everyone through this process. And then you add to the fact that you're right, the individuals that you work for each and every day, that is just a different opportunity that we have got to become, be understanding of it, and be able to make sure that individuals, based upon their sexual identification, are not harmed anymore. And so I'm appreciative of you having this host home concept. I think that's pretty innovative. And I'm sure you're really looking at these homes to making sure that where they're going, that they're safe places for them to be until they can find the permanent housing that individuals need to continue to move forward in their quality of life. So I'm very excited that you are a partner, and I'm just hopeful that all the organizations are culturally competent in dealing with individuals that, are people of color, and to make sure that we're providing as many opportunities as possible to move them forward.
Absolutely.
Because we're not going to change this trajectory unless we are being really focused in on this issue. That is one of the reasons why, I've created the Commission on Black Girls, is because of understanding who's in the shelter, who's being evicted. I mean, there's just so many issues that are around this area. So I'm appreciative that you're a part of this, and want to make sure that all individuals have the opportunity to live, be in safe housing and get the resources they need to move forward in their lives. And I don't know if you want to make any comments.
Yeah, I appreciate you bringing up poverty, because that is the thing. But I think we should bring in trauma as well,
Yes,
just because we know that racism and oppression shows up as trauma in our bodies. And so when you've got people of color and then folks who are part of the community, that creates even more barriers. But were you asking Waverly if she'd like to?
Yeah, absolutely. Do
Hi,
Hi.
I'm Waverly. I go by female pronouns. I just wanted to kind of give an overall perspective of what it's like being 18 to 24 and being homeless. I have a lot of friends who have gone through this and are still going through this. I just recently got out of being 9 months homeless from August to May. I have friends that have children or have been chain smoking while being pregnant, while being homeless. I've had friends like that in Star House. I have friends that are dependents on their boyfriends who are toxic to them, and the only reason why they're still with them is to have housing. They can't do it on their own because of mental health issues or a whole bunch of other things. I've been through a lot in my day. I'm only 20 years old, but I feel like I have to say my day sometimes because I've just been through a lot of different things. I've actually been connected with a few of these different places before. When I was about 17 years old, I was in Huckleberry House twice. Star House, I was at a lot for 9 months while working. And I had actually gotten kicked out of my grandparents' house around this time, well, August of last year. Around this time, I was still up there in Cleveland. And long story short, right down into Columbus, I got a job back that I used to work at, 8 hours into it, but 8 months later, and I'm still in the same exact position. I've been working hard these past 9 months or so with these connections and things and all these different things that are forming, but being 18 to 24 is like middle child syndrome, because you have places like YMCA or something like that where, I'm not trying to say something like that, like disregard organizations like that, but you have different places that focus on these age groups that are like older, you know? And then there's the childhood, and then there's like the parents of kids, but parents themselves are older, right? But when you're 18 and 24, you can be in school and have a family, be fortunate enough to have a family that's paying for everything and working hard to pay for everything. Or you can be 18 and 24 and be like a friend of mine who was still 18, still in high school, barely making it through high school, while supporting herself and me being her roommate and working 2 different jobs at 18 years old and having to have their mom do their schoolwork just so that they can graduate high school. There's so many different places you can be at 18 to 24, that's ridiculous. I just think that it's gotten to a point where all of these different intersectionalities, whether it be a Black woman or a Black trans woman like myself, or any sort of identification in me, like all of them need to be met specifically for that person. It needs to get to a place where all of those needs are met for each specific person. And it's not like that right now. Everything's very general. Everything's very, everything's just very general and it's not meeting specific needs for these people. And when it comes to being 18 to 24, if you're not grown up in certain circumstances where you know where to go, like another person said before, it's not about giving up. It's about giving in to the fears and anxieties of this present world that we live in, and how many different things we're just so ignorant about. We are a very ignorant age group. Very much so. I mean ignorant like the state of not knowing. Like, we are very ignorant, and there's not enough knowledge out there visibly present for us to obtain. And it needs to get to a point where it's like that. And that's all I wanted to say. Thank you.
Thank you, Waverly. Thank you for coming and certainly sharing. And you're right. When you're 18 and 24, when you're 25 to 30, when you're 30 to 40, the 40 to 50, we all need, seriously, everybody needs support. And none of us live in this world in a vacuum. But when you're certainly young, we need to make sure that we have a responsibility of making sure that our young people have the resources that they need to move forward. I appreciate your honesty for coming and sharing that, and I'm very hopeful that this collaborative that is in this room today will be looking out for and being supportive of all individuals that are in need of these services, and will be providing culturally competent services to those individuals. So thank you, Waverly, for coming down and sharing your story today.
Thank you.
Thank you. Our next speaker will be discussing permanent supportive housing, and Samantha Schuler, who's President and CEO of the Community Housing Network. Hi, Sam.
How are you?
Good.
Good. Thank you so much for having us here today. And I'd like to also thank Kim Stans and the Community Shelter Board for their vision and energy in bringing everyone together, because the YHDP grant wasn't an easy one to get. And we appreciate it very much. What I also have come to appreciate, as you know, Community Housing Network provides permanent supportive housing in Franklin County for people who have been homeless, but we've never focused on youth. And I didn't understand when I first started working on this project why that was so difficult. And I think what I've come to learn is there are two systems, and I think this echoes our last speaker. There's an adult system and there's a youth system, and they don't connect to each other. But we have an arbitrary concept of adulthood beginning at 18, and we know that developmentally that's not true. And so, like, housing is often the foundation for so much of the success we have in serving people. And so it's been exciting to be part of using housing as the foundation to start to get those systems to collaborate. And I think the fact that you have what people would perceive as an adult provider, Community Housing Network here speaking about how we'll become a youth provider, speaks to the spark that we have here and the opportunity we have. And so we're very excited to talk to you about the first permanent supportive housing in our community that will target young people 18 to 24 who are literally homeless and who have other significant challenges with mental health and addiction, histories of personal trauma, physical, emotional, sexual abuse, involved in the child welfare system, often rejected by their families for how they identify or for early adult pregnancies, people who have histories of poverty, drug use, homelessness, institutionalization, long-term unemployment, domestic violence, human trafficking. And this is both personal and generational, and physical health issues because they haven't had access to good health care. And that's significantly delayed their development and their cognitive skills. And so they're challenged with relationships, they're challenged to live independently. They've limited employment opportunities, limited educational opportunities, they struggle to parent, and they have low, I think this is the big one for me, there's poor self-image and self-esteem because they don't have support system to reflect that and give them that foundation. And that's why we're so excited about the opportunity to develop Marshbrook Place, which will be permanent supportive housing. Permanent supportive housing offers the foundation that will give these young people a place to be stable, secure, and supported so they can recover and thrive, so that it'll be affordable, so they'll have a rent subsidy. It won't be time limited. They'll have the time they need to live there to and get the support and learn to live independently and move when they're ready. There'll be 24-hour desk staffing there that will be trained with how to engage and how to respond to crisis. So just like the rest of us who are 18 to 24, there's somebody there when things go wrong in the middle of the night. There's also on-site services provided by our service partner, Huckleberry House, who we're very excited to partner with. And I think what will be different about Marshbrook is not just that the target's 18 to 24, but that the services are tailored to that youth group. Huck has extensive experience. They run a transitional living program, but obviously they have experience with this age group from their many years of serving them. So the Huck staff will be on site. Huckleberry House, in my experience, does an incredible job of working with young people in a collaborative way to help them learn to identify, challenge, and change the thinking patterns that have led to where they are, and help them continue to use those skills independently on their own, and sort of reverse some of the things that have happened to them that have delayed that. And then they're also going to use peer teams, which means they'll recruit and train young people that are in the program to help lead groups. Because we know that young people, when they master a skill, like to share it, and they also like to learn from their peers. So I think that's a very interesting part of this housing and important. And so on site for these young people will be case management, counseling, substance abuse, counseling relationship, work, education guidance, employment services, support groups, independent life skills, transportation, food, nutrition, parenting skills. There's a laundry list, but it's essentially like all the permanent housing that we have. We say, what's the gap between where you are and where you want to be, and how you can live independently, and how can we provide the wraparound services you need to do that here and live independently here with that help, and potentially go on and live independently in our community. Just quickly, the site is on the southeast side of Columbus on Chatterton Road. There's a bus stop. There's amenities like groceries and pharmacy and restaurants within less than a mile. We'll have 40 units, including 31 bedrooms and 10 two-bedrooms. Some of the youth will be parenting. So we also have a computer center and a community room with a full kitchen. We'll have a private patio and children's play areas, both inside and out. And offices, of course, for staff. And finally, we do have, in addition to the youth, the YHDP funding that we're getting, the city of Columbus has contributed to the capital cost to build Marshbrook Place, $250,000, and we're incredibly appreciative of that support as well.
First of all, Sam, I just want to say thank you. You've been a great partner with the City of Columbus, and certainly in terms of all affordable housing, and certainly permanent supportive housing, and providing all the other, collaborating with other nonprofits to provide the supportive services to our community. So I wanted to say thank you for that work. But also, this is a great collaboration between you and Huckleberry House, which will be wonderful. I'm also appreciative of, like I said, they're having these peer-to-peer teams, but just being understanding of, as we just talked about in this room today, just the different needs that each of these individual young people have, and that you'll have teams of people there to be able to be supportive. And again, I just think about just young people. I'm a mom, I have 5 children, and I know that every single one of them, and they're now past the age of 24, but however, every single one of them still needs support in different ways based upon them being unique individuals. And so and those of us who are parents or aunts and uncles and, know people that have kids and we're there to support them, all of them need some sort of support no matter what their situation is. And then when you have additional trauma or challenges, that means you need additional support to be able to help them to move forward. And so I'm just appreciative of your work, and again, just really appreciative of everyone in this room that's a part of this collaboration. I'm so excited that we have gotten this money through the Shelter Board. You've done a great work on this to get these dollars to be able to help our young people and to be an example not only for our city, not only for our state, but for our country, that we'll do this very well, and that we can see that if we invest in these nonprofits working with our young people, that more people across this country will be able to help our young people to move forward. And so I'm thankful for you and the work that you're doing, and each and every one of you. So thank you, Sam.
Thank you, appreciate it.
So I'm back. I want to talk a little bit about some of the results that we are expecting to achieve over the course of this grant. And I do want to say, although this was an initial 2-year grant, we do anticipate that it will be renewed by HUD year over year. So we're anticipating that this would be permanently with us, and we are acting as if and building out systems and programs along those lines. We did multi-year analysis to support this new youth plan, and with the funding capacity and other system improvements, we think we'll have a reduction in homelessness among youth by about 8% over the next 3 years. And we're also expecting a decrease in the number of youth and young adults who experience homelessness and who are imminently at risk and go unserved. So we think we'll be getting at both those populations. The proportion of youth and young adults who successfully exit literal homelessness to housing is expected to increase by 16%. And these improvements represent a portion of the improvements needed to effectively prevent and significantly reduce homelessness among all youth and young adults. A Place to Call Home for Youth plan includes shared measurement framework to ensure continuous quality improvement. And the framework contains 16 initial measures that align with plan activities for desired results and outcomes. The measurement framework will ensure the community has data needed to answer questions regarding what was done and what was accomplished, and will be also used to inform the ongoing system improvements we'll make. We're grateful for this initial investment from both the public and private sectors. Additional resources are needed to build out a comprehensive system of programs and services to meet the needs of the youth in our community. And a fully comprehensive approach would also include prevention, which this grant does not pay for, as well as more shelter beds for youth. We have a gap there, and a capacity for more rapid rehousing, transitional housing, and permanent supportive housing. We will continue to seek additional resources to continue to build out a comprehensive system and fill these gaps. And as always, our goal is to make sure everybody in this community, especially our youth, have a safe place to call home.
Thank you, Michelle, and I'll make some other comments. We have a speaker. Is it Kyra? Is it Kyra Drakovich? Good afternoon. And you can please speak your name again and who you represent. And you have 3 minutes to make your comments.
Okay. My name is Kyra Drakulich. I represent the Youth Action Board. I work closely with Aubrey Jones. Thank you, Councilmember Tyson, and other council members for having this hearing on youth homelessness. So I wrote something, but I'm not gonna read it. I'm just gonna say.
Okay.
So I think a lot of youth suffer from homelessness and we grew up in a foster care. A lot of us have been in foster care. I'm one of those youth. And when I turned 18, I felt like they said, you're basically we can't do much more. And a lot of it's trauma. Like, I found my biological mom and she passed away in a year after finding her. And I didn't have nowhere else to go. The landlord told me, hey, you gotta go, I don't know what to tell you. And I wandered around for a month until I actually ran into a youth who used Star House, and then I used those services to build connections. And in the process of being with Star House, I was able to now share my opinion and just express how much I think certain areas for what would really help the youth, because I've been in there off and on for 4 years now. I just now got placed in the YMCA in January, so I have stable housing now. I also have gained employment through Star House with their StarWorks program, which now I'm a manager. And then also with Star House, they have started a mentor program, which I have a few of my mentors actually here today. So, I want everyone to understand that it's not so much the money. Like, the money is a key part into it, but it's really the relationships. So without these relationships, it doesn't mean anything, because a lot of my mentors or some of the people that I work with and everything, they are my family. Right. There's nothing. I don't have anybody anymore. Some of them I consider like my mom or dad or my uncles or whatever, because I don't have anything. I haven't since I was in foster care. I've always felt like I was alone, and now I don't. I feel like if something happens, I have people to run to. And even if I get myself somewhere stuck, they always come to my rescue, and they don't, it's not so much as we're just setting them up for success. No, we're showing them how a family is supposed to be, how supports are supposed to be there. We want to change our future. And I do think that my generation, personally, I'm 23, I'm about to be 24, and our generation is lacking a lot of things. And then a lot of people just, like, some people will walk down the street and see homeless youth or just homeless people in period and just look down on them. And there's nothing to look down on about. It's because we're just at a different place than you. Let me see it. it's just so much about the relationships. I'm thankful for you letting us be here. I'm thankful for all the opportunities that I've ever had. I've always wanted to make a difference, and now I feel like I can finally set things up for the future, or even showing my family that I'm making a difference. And I don't want to be another statistic in foster care either. And I've had some good relationships with the foster care system, but they tried their hardest, but I didn't feel like I was set up for success. So, thank you.
Well, Cara, thanks for, first of all, coming down and sharing your story. This is a hard hearing. This is a difficult hearing. Let me just say that. It's just because it just pulls at your heartstrings. It's my heartstrings just to be able to, to listen to some of the testimony. What I'm happy about is that you have found a safe place to be. And so I'm appreciative of the work of, Ann Bischoff, everyone that is working at Star House, and the work that they are doing to help young people like yourself to move forward. So I'm very thankful for them. I'm also glad that you're able to have a safe place at the YMCA, and that you also are making a difference for other people who have been in your similar situation. You never understand why things happen to people, but I also will say that everybody has a struggle, not just you. Everyone in this room has a struggle. There is no perfect life. There's no perfect life. People can sit here and think, well, she's here, she's a council member. No, I don't have a perfect life. You don't even want to know my struggle, but everybody has a struggle. And so those struggles that we go through are struggles that we don't know why things happen, but we go through those struggles, and oftentimes those struggles will help us to help somebody else, because I truly believe we're all here to serve, that each of us is put on earth to serve. And so you've gone through trauma, you've had a struggle, but you've taken that struggle and you're here to testify about it so other people can hear that struggle, so that we can think about what you're saying and how do you make it better for others. So you will be able to go back and say, I went to Columbus City Council, I shared my story is going to help someone else. And I'm also working with Star House, meeting other young people that have had the same struggle, and that they'll see that you have survived it, and they will see that they can survive it too. So you just know that you are making a difference in people's lives. And for everyone that's part of this partnership, they understand that their job is to make lives better like yours. That's what their job is. And for everyone that will see this hearing play over and over, they will now think about when they see individuals that are young people that are homeless or homeless individuals, to be able to think about them in a different way. So I thank you for coming and certainly sharing your story. And and it's good to hear at your young age how you are now making a tremendous difference in other people's lives. Continue to do that work, continue to be an advocate, and continue to rely on people to help you. Again, because all of us do need help from someone. None of us do things by ourselves. So thank you so much for coming and sharing your story.
Thank you.
So I do want to recognize a couple of the people. I mentioned Star House is in the room. I want to mention the Columbus Foundation is here. Dan Sharp is in the room. Thank you for being here and your work. And for those of you in this room who are advocates of this work, thank you for being here. Certainly continue to be an advocate for this work that is sorely needs to be done because our young people from 18 to 24 are our future. And we have an obligation to making sure that we support them so that they can move forward and with their lives. And because we need them in Columbus to be helping to make our community a better place. So I want to thank each and every one of you, all the partners who have come together to decrease youth homelessness in our community. As your vision states, all youth should have a safe place to call home, and I know that each of you are working hard every day to make that happen. It does take a village to make this initiative like this work. We're always saying it takes a village. It takes a village. We don't do this by ourselves. Along with the community working in cooperation to make a difference. But before we conclude this afternoon's hearing, I'd like to recognize those who have participated in this hearing and just thank you. Michelle Heritage, Executive Director, Community Shelter Board; Aubrey Jones, Youth System Manager from the Community Shelter Board; Becky Westerfeld, Executive Director from the Huckleberry House; Sue Darby, Senior Vice President of Housing for the YMCA of Central Ohio; Donna Powell, Director of Donor Relations and Advancement for the Homeless Families Foundation; Aaron Upchurch, Executive Director for Kaleidoscope; Samantha Schuler, Chief Executive Officer of the Community Housing Network; Kim Stans, Human Services Coordinator for the Department of Development. And I also always want to thank my fellow council members and their staffs who serve our community with pride every day. My staff, Nicole Harper and Carl Williams, the hardworking staff of CTV who make these hearings possible. And also, I have to thank the residents of the City of Columbus who make our city the best place to live, work, and raise a family. And I'm very hopeful that they will see these hearings and begin to think about what ways they can make a difference. And I'm going to ask Michelle that if individuals are wanting to make a difference and be involved in this, to helping make sure we end youth homelessness, who can they contact?
The easiest thing to do is you can contact Community Shelter Board, and the best way to do that is usually by the internet, and if you go on csb.org, you can look for Aubrey's picture, and she would be the one that you can click right on her beautiful face, and it will be hyperlinked into an email, and shoot her an email and say, hey, I'd like to help, and we can get you connected. And there's so much work to be done and so many opportunities for the citizens of Columbus to get involved. And the only way we're really going to get at this in a big way is if we do get more people involved. And so we welcome the help. Again, csb.org, and click on Aubrey's picture on our website, and that'll get you to her.
And if there is either a family member or an individual who watches this hearing and says they know of an individual that needs the supportive services of the shelter board, should they contact, again, who should they contact? Or should they contact the Huckleberry House, Kaleidoscope, all the partners? How can they get connected if they know of a homeless youth?
Best way to do that is for a person who is 18 to 24 is to call the homeless hotline, and they will direct them, and that's 614-274-7000. And then if they're under 18, it would be Huckleberry House. I'm going to let Becky give that information.
I can't turn on the,
Push the green, can you push?
you can call Huckleberry House at 294, I just forgot the number. I'm giving you my direct line all of a sudden. Not a good, thank you. 294, help me out, Sam. I don't call myself very often. It takes a village for real. 294-5553. Thank you, 294-5553.
All right. All right, thank you so much. And again, thank you to each and every one of you who are in chambers this evening. And again, thank you to the partners. And I look forward to getting updates on the success, and hopefully we will be continuing to receive more funds as we move forward to support this and these initiatives, because lives matter. Thank you.